Recognize Senator Laurie Monnes Anderson.
Thank you, Mr. President. Senator Bates and I are both carrying this, and he will be doing the close. Colleagues, this is the worst legislative session that I have had, but it's also the best legislative session that I have had. The worst because we have had to cut significantly into programs that I care deeply about. That's education. When I think about some of the children in my school districts that aren't going to get PE or music, it really breaks my heart. But I don't want to focus on that because this is also the best legislative session that that I have been in, and I want to focus on that today. We are continuing the steps that Senator Bates started way back in 1989 when the Health Services Commission prioritized health care treatment, and that, colleagues, saves us about $50 million a year. We went on, that laid the foundation for some meaningful health care reform, and then Senator Westland comes along with Senator Bates, and they spent 2005 session working on establishing a framework to come up with some real health care reform. And that was the Oregon Health Fund Board. And the entire state of Oregon has had input from the public hearings in Gresham, Central Oregon, the coast, all over the state. And they came together with a report that we have put into making House Bill 2009. And colleagues, it is a great start. It is actually the end of the beginning of health care reform in this state, and we now are going to start getting into the real implementation. House Bill 2009 will begin to make health care more affordable for Oregonians, reduce the number of uninsured, and beginning to bend the cost curve by reducing the underlying costs of health care services. It is going to improve the quality of health care. House Bill 2009 is going to streamline state health functions, which is going to add value and cost savings to our health care system. We have created the Health Care Authority and the Health Policy Board, and we will now have a smaller, more agile, more focused, more manageable agency. Right now, the Department of Human Services has 10,000 employees. 3,000 of those is going to come under the Oregon Health Authority. It brings together all of the state's health and health care activities, including mental health and addictions, public health, Medicaid, Oregon Medical Insurance Pool, Public Employees Benefit Board, Oregon Education Benefits Board, Oregon Health Policy and Research. We are all combining that under one. And they are charged with developing methods to consolidate the health care purchasing pool, and they are also responsible for proposing to the legislature standards and methods for health insurance rate review. Creation of the Oregon Health Policy Board will now eliminate the Oregon Health Policy Commission and the Oregon Health Fund Board. And the board is charged with creating plans for the future of the Oregon health care system to be brought to the legislature in 2011 and 2013. They will work on the feasibility of creating a high health insurance exchange. They will develop cost containment methods by focusing on prevention, primary care, and chronic disease management, and they're going to establish evidence-based quality standards within the state. There's going to be an orderly transition, colleagues. The Department of Human Services and the Oregon Health Authority will have a shared director, and the budget is going to be within the Department of Human Services. And the transition planning will be done in the Department of Human Services, including a plan for joint services. The Oregon Health Authority will become fully operational on July 1st, 2011. Besides that, the Senate passed 7 bills that cut costs and have quality improvement to our health care system. And all of those have been put into House Bill 2009. We have created the PULSE, which is a physician-ordered life-sustaining treatment registry. And basically that is going to coordinate health care treatment. The state is going to contract with the Oregon Health Sciences University to develop, implement, and maintain that registry. I cited an example of my father who was taken to the hospital and his pulse wasn't with him and he was brought, so to speak, back to life when he just wanted to pass away. This happened 2 different times to him. If the pulse registry had been in place, healthcare providers would have known. We're going to give consumers the tools to make better health care decisions. We're going to increase the focus on prevention and disease management. We're going to require transparency and accountability of our health care dollars. We're going to standardize and simplify insurance paperwork. And we're going to be investing in health information technology, workforce development, and a better way to shop for insurance. All of that, colleagues, is in that huge stack that you have that comprises House Bill 2009. It's a wonderful bill. I am so excited to be a part of this, and this is really what's going to make this session such a successful session for so many of us, and definitely for the state of Oregon. I urge you, and I vote on behalf of all Oregonians who truly do want health care reform. Thank you, Mr. President.
Thank you.